The idea was to give some sort of an overview over the topic of BPSD. BPSD means behavioral and psychological signs and symptoms of dementia. Sometimes it's called neuropsychiatric symptoms, which is an extremely important issue because of two reasons. The first is the frequency of BPSD. You know that dementia is extremely frequent, and if you look at long time prevalence rates, 5-year prevalence rates of BPSD, you come up with something like 100%, not exactly but almost 100%. So every patient at a given moment during his dementia will develop BPSD, some sort of BPSD. So it's extraordinarily frequent. And the other reason why it is an important topic is that the consequences of BPSD are or can be devastating for the patient and for the caregiver. BPSD is an extremely stressful thing for the patient, for the caregiver. It's probably the major reason for institutionalization of a patient, nursing home admission, things like that. It is probably one of the major reasons why caregivers decompensate. It's probably something extremely costly, not only in terms of difficulties for the patient and for the caregiver, but also something that's very, very costly for the society. About probably 30% of the costs of outpatient dementia care is related to BPSD. So it's a topic that is outstandingly important for dementia care in general. As there is so much suffering on the patient and on the caregiver side, you obviously have got to treat these patients in a way, and that can be very different from what we have in terms of disease-modifying treatments, because there's as good as no disease-modifying treatment for dementia, be it Alzheimer's disease, be it vascular, be it frontotemporal, be it Lewy body disease or whatever. There's not much in terms of disease-modifying treatments, and this is why the idea of symptomatic treatments of BPSD and stuff like that is so important. There are a certain number of treatments, of approaches, depending on the etiology of BPSD. And there are many reasons why somebody develops behavioral or psychological signs and symptoms: psychotic, affective, anxiety, agitation, aggressiveness, and many others as well. And there are many reasons why people develop that sort of thing. Things obviously can be the brain lesion, it can be the dementia stage, it can be the defects in neuromodulation, neurotransmitters, it can be some somatic disease, it can be pain. People with dementia who have some painful condition react through BPSD, agitation for instance, or anxiety, things like that. So you have a whole lot of different approaches you can use, treating the somatic condition which may have triggered the disorder, BPSD in fact, or you can use drugs, psychotropic drugs, in order to diminish at least or try to treat these symptoms and signs of dementia. You can use, let's say, psychological behavioral treatments, and one of the more important things is to take care of the environment, the physical environment, but more particularly the caregivers, the informal caregivers, meaning the spouse, meaning the children, meaning friends, and all these people have got to care of the patient who's got Alzheimer's disease.